Medications play a role in the treatment of many psychiatric disorders, from mood disorders to schizophrenia to ADHD and more. Learn how they can help, what their limitations are, and the relation between the brain and the mind. Next on Speak Your Mind. Welcome to Speak Your Mind. I'm Dr. Carolyn Phelps, licensed psychologist with the Human Development Center. In the last 4 years, we've talked about medication in the treatment of mental illness in kind of a piecemeal fashion, but tonight we have an entire show dedicated to this topic, and because it's a big topic, we're going to get right to the main course of this show. So if you have questions about medications in the treatment of mental illness, call now. Locally, dial 218-788-2844 or call toll-free at 1-877-307-8762. And you can also email us your questions using the address listed at the bottom of your screen. Now let's meet our guests. Dr. Steve Bauer is the medical director at the Human Development Center. He's board certified in child, adolescent, and adult psychiatry. And Dr. Peter Miller is board certified in neuropsychiatry. He's the former medical director of the Human Development Center, and now he's helping to develop programs for the state of Minnesota. And we should add, Dr. Miller, that the views you expressed today are Dr. Miller's views, not the state of Minnesota's views, right?
That's correct. Thanks.
Working in that little disclaimer for you.
It.
And I think what we're going to do for you in the viewing audience, we're going to start broad for a few broad questions, and then we're going to talk about some specific classes of medications. And I think a good place for us to start, Dr. Miller, would be, and this is about as broad as you can get, the role of medications in the treatment of mental illness.
Okay, well, it is a very broad question. We think of the era of medications in psychiatry as starting in the 1950s with the introduction of the first antipsychotic medication. There have been things that have been tried before that, but certainly that made the biggest impact simply from the discovery that a certain medication helped in a surprising fashion reduce hallucinations in patients who'd had them for many years. Following on that was the development of medications that help with depression, with antidepressant medication. So there are a couple of major categories. There always have been medications that even pharmacological substances besides medications like alcohol, which help with anxiety. But again, in the 1950s and 60s, we started to begin to develop specific medications that are very helpful for many of the symptoms of anxiety. So there was really quite an explosion of research from the 50s through, I will say, the early 90s. In a way have kind of leveled off with not too many new medications coming out that are truly different from old ones, but those are some of the major categories of medications that can help with mental illness.
And that really were life-changing for some people. When you take a look at back in the day, people who were grossly debilitated by hallucinations, that we didn't have medications for them, the difference in those people's lives now with medication compared to back when we didn't have antipsychotic medications to use.
Very true. My father used to work in state hospitals in the early 50s when they were still using insulin shock and other treatments as a way to try to help people with severe symptoms that we look back on now, and there were certainly things that were helpful, but not always.
One indicator in the early 60s, at the height there were 16,000 patients in state hospital beds in the state of Minnesota. Right now we have less than 1,000. So a lot of that is due to other things, but medications have played a big part.
Have played a large role of that. And at the same time that we had this burgeoning of medication, there also was this almost anti-psychiatry movement that was getting a groundswell as well. And so you still have people like Tom Cruise going on other talk shows, jumping. He won't be on this talk show, jumping up and down on the couch, and really kind of the anti-psychiatry, anti-medication movement. And talk a little bit about that, Dr. Miller.
Well, I guess I would like to compare it to what happens in the rest of medicine. I think we know that there's at times over-prescription of antibiotics, for example, and I think once you have something that seems to work very well, there's a temptation to use it for more and more things, for milder and milder problems. And so at least I think that's part of the issue. There certainly are people who have vested interests, and they have their own approach, and they think that by attacking medication that will help their approach. But I think some of it, we have to take some ownership that physicians at times are too quick to write prescriptions, and we need to have a good balance as when a problem is severe enough and we have good evidence that medication can be effective. So it's a balance, I think, of a number of different reasons.
When you take a look at when people are deciding whether maybe it's been recommended that that they take medication for mental illness, and they're trying to decide, do I take the recommendation, do I leave the recommendation? One of the concerns that I hear in my office, I'm not a psychiatrist, but I talk to lots of people and try to encourage them to follow psychiatrist recommendations, but is that they're afraid the medication is going to change the essential essence of who they are, and I won't be myself anymore. And what would you say to that person?
Well, I too hear that quite a bit in my office, and I think there are different ways that different medicines help people, and for the most part, our medications do not change the basic personality nor their true range of emotion and other things. It quite often is the ability to function better that is the real goal of medication. We're supposed to only prescribe in situations where function has been impaired, and the goal of medication, from my perspective, best medications are the ones that you don't notice, but other people notice you're doing better.
And I sometimes say in relation to that the medication sort of helps you to be your real self, your true self, because it's your mental illness that's covering up the real person who you can be then.
And not only that, there's some really good recent research showing that it actually helps people make better use of their psychotherapy. So it's not as if these are opposing things. A medication can help a person think a bit more clearly, be a bit more activated, and engage in the work that they have to do, as you know very well. Psychotherapy means a lot of work. And,
it does.
Change is a lot of work.
And I often wind up referring people to a psychiatrist or back to their medical doctor because we've tried working, and what is clear is that their biology just is not allowing them to be able to work on that between session homework. They're too fatigued, or they can't concentrate well enough. They clearly want to do this, but they're just being incapacitated by their illness.
Yeah, and I would just add that there are medications that certainly some therapists have found to not work so well when they're trying to do therapy. The benzodiazepine class, medicines like Valium and those kinds of things, may sedate people an awful lot like alcohol and make therapy harder for them to gain from.
Dr. Miller, talk a little bit about the factors that might other factors that might determine the efficacy of medication. Things like alcohol and drug use, as an example.
Well, we know that among people with more serious mental illness, as you mentioned, alcohol and drug problems, something like 65% of people with serious mental illness will also have a substance use problem, and that certainly can be a factor as far as, is the medication maybe going to over-sedate the person, or are there going to be some medication interactions that are problems? But more than that, there's a whole host of other physical illnesses that we have to be thinking about. None of these medications are absolutely free of side effects. There isn't any medicine that's free of side effects, and so we have to look at the possible risks to problems like weight gain, cardiac problems, and so on. So there's a lot of things that have to be balanced in looking at the health of the person. As you say, substance use, their age can make a big difference as well.
And their age often determines just your prescribing practice as well. How young is too young, Dr. Bauer, since you treat children and adolescents?
Yes, and so you know, the youngest medicines have been studied in is probably age 2, which to me is really only in a most severe kind of state of dysregulation would something like that be the added piece, because obviously you would want them in a better situation and finding the most safety and security that you can get. Otherwise, the medication is not going to be very helpful in those situations, no matter what. So, but you know, I think we see people getting concerned between 5 and 6, and certainly as kids enter school, there's a push to try to look at the different diagnoses and consider medication. But similarly, even for kids who are a little older that way, I think it remains best that we try non-pharmacological things and work on as many of kind of letting them develop when we can. And if things are so severe that, you know, someone might get hurt or they're at risk, I think then we consider medications based on those factors.
And the opposite end of the pole there, medications, psychiatric medications in the treatment of mental illness in the senior population.
There's a couple of issues here. One is as people who have mental illness age, they typically may continue to have some of the symptoms, if not many of the symptoms of those illness, and may need to continue to have treatment that was effective when they were younger. And typically the same medications can be effective, but as we age, our bodies often need less medications, so we may need to be adjusting doses and so on. There's also the question that there are illnesses that really are more specific, at least to the elderly age spectrum, and that is problems like dementias, Alzheimer's disease, and so on. And we do have medications which at least provide a bit of benefit, better than not giving medications. They're not by any means curative, but there are some medications that need to be considered when there are these kind of late life dementing illnesses.
And we know that, I believe, but you're going to correct me if I'm wrong here, that medications that help people slow down maybe the dementing process is best treated. The earlier the better.
Yes, we think so, but it's interesting that if you step one step back to people who have what we think of as a kind of a pre-Alzheimer's or pre-dementia state, all the research so far does not show that the medications given in that stage are helpful. So if you just think you're on the edge of, and maybe you have a family history of Alzheimer's, should you start taking the medications? Well, really, at the current state of our knowledge, there's no benefit until we know that the dementia process for sure has started, at least, but then probably as early on in that process as we can go.
So that's really great information. So you really want a definitive diagnosis of a dementia, and not try to beat it to the punch. In this case, beating it to the punch isn't going to do you any good.
And there are side effects, as I say, of all medications, so it's best to not use it until you have the illness.
Let's talk about some of the silos of medication now. Antipsychotics, we're going to start right there. Antipsychotics, who are they typically prescribed for in terms of the mental illness, and what symptoms do they best treat?
All right. The antipsychotics, as the name implies, are first usually studied with schizophrenia. And folks with schizophrenia, you know, it's been a consistent pattern throughout countries all over the world. 1% of the population winds up with something like this illness, and maybe as much as 3% with other similar kinds of disorders. The medications themselves are fairly effective. We've gone through a couple of what are referred to as generations, and the different way that we categorize them, you'll hear many different names used, but the medication that was probably most influential initially, Thorazine, was the first one that Dr. Miller referred to as starting to help with these things. And then Clozaril was something that came along and really made a difference in how many people needed to stay in the state hospital at that point. Since Clozaril, there have been several newer generation medications, or atypicals as we refer to them, that probably have a combination of helping balance mood as well as help decrease hallucinations. And so those two quite often exist in other diagnoses like bipolar or schizoaffective disorder.
And we have a question here, Dr. Miller. This is on the same lines. A man from Cloquet is asking what's Seroquel and what is its effect on sleep? And I like this question because we often see Seroquel being prescribed for people who don't have a psychosis and because they have sleep problems.
Right. And that gets into a very good question that you sort of alluded to, and that is we have different classes of medications, and the whole issue of sleep treatment is we could have a whole session, whole evening on that. Hopefully we really try a lot of non-pharmacological things before moving to medications. But there are some people who have types of problems where medication for sleep makes sense. But some of those are some of these habit-forming, addictive benzodiazepine medications that Dr. Bauer referred to. And one response has often been, well, let's try something that doesn't have that profile. And unfortunately, Seroquel or quetiapine and a few other similar medicines have been used for this purpose of sleep alone for someone who doesn't have psychosis. And they can be very effective. The problem is that there also are adverse side effects. And I often like to think about treatment of psychotic illness like treatment of cancer. That is, we have some powerful medications that can really help a lot. They don't help everybody, but they can have some very powerful side effects, and you really don't want to jump into using those type of medications. You wouldn't use an anti-cancer medicine for a lesser problem, and I think that's really how we should approach sleep problems as well, ideally. Now, these medications get used, and we have to encourage each person, if they're taking these medications, to talk to their own doctor. But over the long term, if a person's taking these kind of medicines, they may need to have to, if they're going to change them at all, do that over a gradual period. It's not something that anyone should go out tonight and stop immediately taking something that's being prescribed.
And so
obviously.
One of the things I like that what you said when you made the analogy between the treating cancer and treating mental illness is that notion that these are powerful medications. You don't want to take an anti-cancer medication if you don't have cancer. On the other hand, it really can save your life.
Absolutely.
If you need it. And I think a lot of our patients find that some of these medications have been life-saving for them and certainly life-transforming for them in their ability to lead the life that they want to lead.
Absolutely.
Which is how we get from 16,000 in the state hospital
Right.
down to 1,000 in the state
And
hospital.
not just being out of hospital, but many patients I've followed over the years who've been able to have jobs, get married, have kids, and do all the kinds of things that people ordinarily want to have in their life that they wouldn't have been able to do without these medications. So they are life-saving and life-transforming in many cases.
Antidepressant medications. Let's move on to those.
All right. Again, we have a couple of different classes. The early effective medicines were tricyclic medicines and the monoamine oxidase inhibitors that were each using the previous analogy a little more difficult to use, and now newer antidepressants have decreased the number of side effects, but probably lost some of the efficacy for some of the folks. So the groups of serotonin specific or norepinephrine and serotonin specific medicines, there are several of those out now, and many of them are reasonable treatments for folks who have struggled for years with seasonal affective disorder and other things that we're pretty familiar with up in this part of the region. And the medicine themselves become a big part of the overall treatment, but probably not all of it by itself.
And one of the things that we like about the newer, the newer, which aren't so new anymore, antidepressants relative to the older ones is their relative safety in a patient population that's at greater risk for suicide. So harder to overdose on the newer medications. Here's a caller, Dr. Miller, a man from Duluth, asked for a person on an SSRI, selective serotonin reuptake inhibitor. Is it best to continue on the medication for life? And I just think, I like the last half of it, you know, forget the exact medication.
Right.
Are there medications that you have to continue on for the rest of your life?
I'm going to jump on the name of the medication for just an instant because so many of the antidepressant medications seem to have some effect on this transmitter in the brain called serotonin. But I often hear people say, gee, I just have a chemical imbalance, as if you just get the right amount of serotonin and all will be well. And the research we have on the brain is that it's so much more complicated than that, that people need to understand that, number one, we really aren't sure which chemical affecting in the brain is the most critical, or which systems in the brain, or how the other things in life affect that. So just to be aware that we have all these fancy names, but we may not know as much as it seems about exactly how these medications work. How long should a medication be taken? Well, the best research to date has followed people consistently out for a period of about 5 years. Who have recurrent depression, serious depression, and has shown that there continues to be a higher risk of relapse of depression for people who go off their medicines out as far as 5 years. So the advice I tend to give patients is, if they've had, that means people who've had 3 or more episodes of severe depression, they probably should take that medicine at least 5 years, and there's no evidence out there that says when we should stop. So then it becomes much more personalized decision. Is this medicine seeming to help? Is it causing side effects? The risks of relapse can be very major. People with very severe depression can become suicidal, can be unable to work, all sorts of family implications. And I've certainly had patients who wanted to try going off medicines, and others who said, you know, this works for me, I don't want to mess with it. And that becomes a personal decision between them and their physician.
I like that's an experience. That, number one, it should be a conversation that you have with your physician. But number two, it can be an experiment that you do, right? That you can try the medication vacation if that doesn't work. It's an option that exists out for you. And if now's not the right time for it because there's certain things going on in your life, where even knowing the answer to the question, you know, you've got too much stress in your life right now, you've got too much change going on in your life. If we went off, had you go off the medication right now, we wouldn't know. Is it because you just went off the medication, or is it just because life is too stressful right now?
Yep. The other side of that, though, is that there is some mounting evidence that every episode of depression, or we haven't talked about, but mania, manic depressive illness, every episode increases the risk of later problems like dementia. And so there's an impact on the brain of having an episode of depression. And so while I agree, at times it's very well worth cutting back on medicine, maybe stopping it and seeing if you're going to have problems, it's not a good idea to go up and down off and on medication. Make some decisions, but then stick with them for a relatively long time if possible.
This now, and we're going to be getting short of time on this, 3-hour topic that I've squished into 24 minutes. But then, when I listen to Dr. Miller talk, I think like, well, I want to see either Dr. Bauer or Dr. Miller. When I hear either one, I want to see somebody who has that much knowledge and that much research. At what point, because a lot of people are prescribed their psychiatric medications by their primary physician, and at what point do you need to be thinking about switching over to a psychiatrist?
Well, that's a great question, and I think it has a lot to do with the comfort level and experience of the primary physician to some degree, and availability, which unfortunately in this day and age has become the bigger problem. So what we see that our government is suggesting for us, and certainly not the state, I'm not making any big reference, but the Affordable Care Act really emphasizes collaboration, and that becomes that when you have a spot where you need some more information or that kind of thing, can you see a psychiatrist, get a consultation, and then have your primary care manage that. So that said, I would say that things like Depression, most primary care, this is a very common illness. Anxiety, similarly, very common. They're fairly comfortable with some of the early treatments, and if they work, there's really no need to move on unless you have concerns that they don't feel they can answer. There are lots of primary care who call us and say, this one's beyond my scope. And at that point, clearly, having psychiatric consultation is important.
So playing well with others is a good idea.
Absolutely.
We are at the end of this show, and because, like I said, I put a 3-hour show in 24 minutes, and so we don't get to all of these. Look at all of these questions. Now, you will be able to read the answers to some of these questions on my blog, and a lot of the questions that you called in were not about medications. I'll be answering those, and I'll be finding an expert to answer the medication ones for you, because that's not me. So weren't they great? And thank you so much for Dr. Miller for driving all the way up to the cities, and it was so nice to have him back and so nice to see him here. And Dr. Bauer is, as always, a wonderful guest. Don't forget to visit us on speakyourmindonline.org, where you can find a schedule of our topics and resource links, and read my blog, the place where I answer more of your questions. And you can also email us your questions about next week's show, when we'll be talking about work stress. Not that anybody has any trouble with that. I'm Dr. Carolyn Phelps. Thanks for watching, and good night.